Hi everybody, this is Azar, Doctor of Physical Therapy. Today I want to talk about thumb injuries. Thumb is very important part of our body because we are doing a lot of fine movement with it. We're doing scissoring, doing the cooking, chopping things, and we can do washing stuff and do a lot of things, cleaning, pushing the bottoms. So a lot of things we can do with the thumb. And if the thumb is not in trouble, then we're gonna be in trouble with all functional mobility and all of our activity, daily living. So the first thing that can happen for the thumb is the tenosynovitis of the corven, which is the tendonitis of the thumb abductors, which that motion can get painful. Also this motion, especially with the resistance. So what we can do, we can see first where is the tendons located. If you open your thumb, you can see the little triangle here, which we call it anatomical snuff box. That's the old terminology for it. So during that movement, you can see that hole can get more prominent, and you can see two of the legs of these triangles. And these legs can be the tendons that we're talking about. These tendons starting from here, going all the way up here. And then all of these part of the tendon can get inflamed when we have a Corven syndrome, which is very common. The test that we can run for this, we can put our finger here, okay, open the fist, close the fist, and then we're gonna do this movement, ulnar deviation. If you feel ouch and we have pain, that's the Finkelstein test positive, means that you most likely have the tenosynovitis of the corven. I'm going to show you the picture of that anatomical snuff box and this tendon. You can see the tendons are so angry in this picture. The next picture I can show you is the actual tendons. That you can see the tendon sheet underneath that little ligaments. They got really angry and very inflamed. And then I can show you another good picture right here. You can see the red tendon that's angry and inflamed. This is the decorven. What we can do, a lot of people choose to do injections. That's fine. They can do injections, they can get better. Hopefully the inflammation can go down. But a lot of people don't want to do injections and they want to do it with the physical therapy. So first thing first is getting rid of the inflammation. Icing on that tendon, massaging, very important. You can do self-massage on these tendons. Find them first. Massage, you can do cross-friction massage. Put your finger here and go 90 degrees across that tendon and massage it, right? And then ultrasound, laser, they can happen in physical therapy sessions. Go to physical therapists, they're gonna do it for you. And then the stretches, very important. So you might wanna say that, okay, we stretch it just like the same as the test. Yes, that will stretch the tendon, but at the same time it can aggravate the tendon really bad. It's not going to tear the tendon, hopefully, if it's not too inflamed and too damaged, but it's going to be very aggravated. So you can do it in the 3 stages. So first, with open fingers, do this. If it's fine, okay, perfect. Then go ahead and close your fist and do this. If it's still okay, you can go ahead and bring your thumb in, which is the most painful stage, and then do this. And hold it for 30 seconds to 1 minute and release. You can do it up to 10 times every day to release that tendon. And then what else we can do? We can go ahead and massage the area that we call it thenar eminence, right here. These are helping with all the movement of the thumb, and they can get really overused and very tender in that injury. And we can go ahead and massage these, again, cross friction massage, 90 degrees against the fibers of a tendon. Okay. You can do a lot of bracing, a lot of resting. That's going to be very crucial, very important. As you can see here, we can show you that brace that can put the thumb in the resting position, or we can use another braces. This one. That's a very small convenient brace, but it can give a thumb a good rest and put it in the neutral position. So another stage of the therapy will be range of motion exercises. You probably have limited range of motion of the thumb. So what you can do, you can start giving it a little bit of stretch, different direction. We call that abduction. You can do it this one, palmar abduction, radial abduction. You can stretch it slowly to oppositions with other fingers. So oppositions, stretch. You can do active range of motion of the circular movement of a thumb, because remember, thumb is a very good movable joint, and it has to have the circular movement finally. So you can do some circular movement, clockwise, counterclockwise. And of course you can start doing strengthening exercises if you feel you're ready. That's the last stage, like always, a lot of strengthening at the end with the resistance. We can do this one with the clip, right? You can do it in the circle opposition. You can do it with the other fingers, okay? You can do abduction of a thumb. Okay, you can do palmar abduction of the thumb. You can do the full abduction of all fingers, right? Like you can of course do this one, trying to read the paper, okay? Give it more resistance, okay? And then a lot of grip strengthening exercises. You can do it with the putty again, our friend, therapeutic putty, or you can do it with the squishy ball. And you can do some of these movements with the thumb, okay? Try to stabilize that joint. Close to that is a CMC joint. You can get eventually arthritis if you don't treat the de Quervain syndrome. Finally, you can get arthritis in here, and that's going to be very annoying. You can do all of the movement that we done with the putty, okay? All of the pinching, gripping, abductions, everything. So first, get rid of inflammation, go to physical therapist. You can do self-massaging at home, then stretching, range of motion exercises, and at the end we're going to do resistive exercises. We can also do resistive stuff, especially this one, the deviations. That might be very painful at the early stages of a therapy, but at the end we have to make sure we can do this. This one, ulnar deviation, okay? And you can do other wrist strengthenings, okay? That was about the Quervain syndrome. Very common repetitive movement of the thumb, as most of us do during the life, and hopefully that video can help you with that symptoms. Have a great day. Bye-bye.